Hi, it's Matthew Cooney from ProstateCancerLetter.com, here to talk to you today about chemotherapy for your prostate cancer. Chemotherapies are medications to treat cancer that are given through your vein. The two medications that are approved for prostate cancer are Docetaxel and Cabazitaxel. They take about an hour to infuse, and you get these medications every 3 to 4 weeks. You need chemotherapy if your cancer has become castrate resistant, it's spreading outside of the prostate, such as into the bones, lymph nodes, or other organs. Your PSA is increasing, and you may even be having pain. You know the cancer has spread if your bone scan shows that the cancer is in the bones, or perhaps a CAT scan shows that there's cancer in your lymph nodes or other organs. Interestingly, chemotherapy was discovered actually from a tree bark. The Pacific yew tree grows in the northwest, is slow growing, and grows to about 10 to 15 meters in height. In the 1960s, scientists figured out that the tree bark actually had anti-cancer properties, but it wasn't until the 1980s where Docetaxel was developed from the same properties of this tree. In 2004, Docetaxel was approved for the treatment of prostate cancer in attempts to inhibit cancer growth and spreading. Cabazitaxel is a cousin of Docetaxel, who was developed later. It's given after Docetaxel stops working, and it was approved for use in 2010 by the Food and Drug Administration to treat prostate cancer. The side effects of chemotherapy are generally mild with either Cabazitaxel or Docetaxel. It could include a 50-50 chance of losing your hair, about a 5% risk of infection, less than 10% risk of any nausea or vomiting, numbness and tingling in your hands or feet, anemia, or some loss of taste. Unfortunately, chemotherapy will not work forever. Chemotherapy will not cure your cancer, and even though chemotherapy can slow the growth of the cancer, improve your pain, make you live longer, eventually the cancer will become resistant to chemotherapy. What should you do when a chemotherapy stops working? You need to consider other medications that affect male hormones, such as abiraterone acetate or MDV-3100. You can consider radioisotopes to help decrease bone pain, or you can ask your doctor about clinical trials for other medications. At ProstateCancerLetter.com, learn more about hormonal therapy, chemotherapy, and exercise and nutrition to battle your prostate cancer.